Now you can help your pediatric patients with dental caries, right in your own office. Follow along as we cover 4 easy steps for applying silver diamine fluoride, also known as SDF, and fluoride varnish to your patient's cavities to prevent further decay. Prepping the room for your patient. Before starting the SDF and varnish application process, you'll want to gather all your supplies so you can easily access each item as you go. We also recommend placing a plastic cover over your prepared tray prior to preparing your materials. Because the SDF will cause staining, be sure to wear gloves and protective gear for your clothing and have a bib and protective eyewear for your patient. You will need a disposable mirror to identify any dental caries, white petrolatum skin protectant or Vaseline to protect the gums and lips surrounding the affected area, cotton swabs to apply the protectant, gauze to dry the affected area prior to application, a cotton roll to isolate the area, fluoride varnish to apply after the SDF, a micro brush for applying the SDF, a disposable container like a Diamine dish to hold the SDF solution, and silver diamine fluoride solution. For easy application, squeeze a pea-sized amount of the petrolatum skin protectant on your prepared tray. Open your varnish and premix, and pour 1 drop of SDF solution into your disposable container. Prepping your patient. Start by identifying the location of the dental caries. Remember, SDF is a pulpal irritant, so it should only be used when the pulp is not involved in a carious lesion. Make sure to disclose to your patient and their guardian that SDF causes irreversible staining on teeth and obtain verbal and written informed consent prior to application. It is highly recommended to include photos of the potential staining on the consent form. Once your patient and their guardian are fully aware of the effects of SDF and have consented to treatment, position your patient on the exam table. Make sure your patient has eye protection and a disposable bib on their chest to prevent unwanted permanent staining. Proceed with the application process. Use the disposable mirror to identify any dental caries. Apply petrolatum jelly to the surrounding gums and lips so they don't get stained. Use gauze to dry the area you'll be working on and remove any debris or plaque from the cavitated lesion. Use a cotton roll to isolate the affected area, as SDF can stain soft tissue. Use a micro brush to apply your pre-poured SDF solution to the affected area. Allow the SDF solution to dry for 1 minute and retract soft tissue away from the lesion. After the SDF has dried for 1 minute, apply the pre-mixed fluoride varnish to the same area. Remove the cotton roll and ask your patient if they would like you to remove the petrolatum skin protectant. Set expectations with your patient and review key oral health habits. Once the SDF and varnish application is complete, remind your patient to avoid food and drink for 30 minutes to ensure proper adhesion. Also be sure to remind your patient and their guardian that the staining is permanent. Help your patient schedule a follow-up in 3 to 6 months for re-examination and additional SDF reapplication if needed. Because this patient is at risk for future dental caries, be sure to review proper oral hygiene habits, provide nutritional counseling, and connect the patient and their guardian with a dental home. Thank you so much for your continued dedication to the health and well-being of children and families in Illinois. This video tutorial was made possible by the Office of Health Promotion through the Illinois Department of Public Health. Thank you to the team at Erie Health Reach Waukegan Health Center for sharing your space. And thank you to registered public health dental hygienist Denise Galaviz for modeling the application process for this tutorial.